Pelvic organ prolapse. When the organs of your pelvis, including your bladder, rectum, your colon, urethra, your vaginal wall, and more, can descend down out of their assigned locations in your body. This is a product of extreme downward pressure, a lack of upper abdominal support that would normally hold your organs in place, and pelvic floor weakness and dysfunction. It's measured in degrees from 1 to 4, 4 being the most extreme. If you're suffering from prolapse, then you're going to be extra focused on the feeling of pressure in your abdominal wall and pelvic floor, so that as you are rehabilitating the entire core together, you are aware of where your strength is coming from. If your PT recommends Kegels, then do your Kegels daily, multiple times a day even. Working with phase 1 of the on-demand program, particularly with breath work for engaging your transverse abdominals in conjunction with your pelvic floor and your pelvic corridor, can be very effective. When standing, make sure that you're doing squats and lunges from a deep connected place of your pelvic corridor. You don't want to be standing feeling a lot of downward pressure. You want to be able to feel that you're pulling up. Incontinence is similar to pelvic organ prolapse. There are varying degrees and varying types. It can be very effectively treated with a combination of pelvic physical therapy and these exercises. For scar tissue, you want to make sure that you have checked in with your physician and talked to them about scar care. Oftentimes, once the initial wound has healed, whether it's cesarean, episiotomy, tearing, you want to make sure that that scar tissue is getting mobilized. So that can be any range of massage or just touch, sometimes a little bit of oil along the scar line. We want to make sure that the tissues are not fusing together. When that happens, it can create, in essence, a wall in your muscular system, and it stops contractions from working well and together.